Now let's discuss heavenly star points of Madanyang, Ht5 Tongli, and Lieque, Lieque. Ht5 is located one soon proximal to the ventral wrist joint space, the most distal transverse wrist crease, on the radial side of the tendon of the flexor carpi ulnaris muscle. How to find? Position the forearm in a relaxed position, in a relaxed fashion. The location of the ventral wrist crease is variable. Therefore, the proximal border of the pisiform bone provides a more reliable landmark. Ht7 is located on the wrist joint space, radial to the distinct tendon of the flexor carpi ulnaris muscle. Locate Ht5, one soon proximal to Ht7, also on the radial side of the tendon. Located along a line on the radial aspect of the tendon are Ht6, 0.5 soon proximal to Ht7, and Ht4, 1.5 soon proximal to Ht7. Lung 8 is also located, 1 soon proximal to the ventral wrist joint space, but on the radial aspect of the forearm. Needling vertically 0.3 to 0.5 soon or obliquely 0.5 to 1 soon in a proximal or distal direction. Caution, needling may be painful. Actions, indications. Regulates and strengthens the heart chi, the main point, and the heart rhythm. Calms the shen, benefits the tongue, benefits the bladder via the Tai-Yang channel, opens the channel and luo connecting vessels. Special features, luo connecting point, the Madanyang heavenly star point, main point for regulating and strengthening the heart chi. Calms the mind, so for sadness, mental restlessness, anger, fright, depression, agitation. Tonifies heart chi, palpitations, weak heart chi. Benefits the tongue, loss of voice, aphasia, stuttering, stiff tongue. Benefits eyes and head, red eyes, eye pain, red face, headache, dizziness. Regulates the uterus, excessive menstrual bleeding, benefits the bladder, and uresis. Ht5 was included by Madanyang, the great physician of the Jin dynasty, among the 11 heavenly star points, his grouping of the most vital acupuncture points, and was indicated by him for inability to speak despite a desire to do so, vexation and anger, pounding of the heart. When excess, there is heaviness of the four limbs and the head, cheeks and face are red. When deficient, there is inability to eat, sudden loss of voice, and an expressionless face. Ht5 is junction point, audacity point. This point enables a deeper connection to be made with the patient. Being the junction point, it communicates with SI. In doing so, it harmonizes these two officials and brings in the discriminatory influence of the SI to maintain the heart's virtue and thus the mandate of heaven. Connects to the tongue and eye for stuttering and speech disorders, palpitations, neuralgia, or spasm of the arm. Helps to see further beyond the mask, enables the patient to be more in touch with their real self. A peaceful point that gives strength and stability to a person shocked or traumatized, aids clear thinking and communication, helps maintain emotional harmony. Next, we go to lung 7, Lieque. Location on the radial aspect of the forearm, directly above the thyroid process above the styloid process of the radius, approximately 1.5 soon, proximal to the wrist joint space or wrist crease in a V-shaped groove. How to find? Place the palpating forefinger on the anatomical snuff box. From there, glide proximally over the styloid process of the radius and locate lung 7, where the finger can palpate a cleft between two tendons, brachioradialis, abductor pollicis longus. Or, using the tiger mouth grip, spread the thumb and forefinger of both hands, crossing them so that the forefinger of one hand comes to rest on the styloid process of the other, but avoiding bending the wrist. Lung 7 is located directly below the tip of the forefinger in a V-shaped groove. Needling. Lift the skin above the styloid process by pinching it. Insert the needle 0.5 to 1 soon obliquely and proximally, reducing or distally tonifying. Caution, cephalic vein. Actions, indications, supports the occiput and head, releases the exterior, expels wind, descends lung chi, opens and regulates the renmai, regulates the water passages, opens the channel and luo connecting channel, alleviates pain. Special features, luo connecting point, opening point of the renmai, Madanyang heavenly star point, Kao Wu command point of the occiput, exit point. Lung 7 releases the exterior to expel exterior wind. Sneezing in allergic rhinitis, affects the head for headache, treats the effects of worry, sadness, and grief, affects menstruation with kidney 6, affects the bladder and opens water passages for urinary retention. It may make qi rise to the head to treat sadness and poor memory, affects the large intestine and defecation for constipation in the elderly. Lung 7 was included by Madan Yang, the great physician of the Jin dynasty, among the 11 heavenly star points, and was indicated by him for one-sided headache, wind painful obstruction, and numbness of the whole body, obstruction of phlegm in the upper body, and lockjaw. The glorious anthology of acupuncture and moxibustion by the Ming Dynasty author Cao Wu includes lung 7 among the 4 command points for disorders of the head and neck. In the Ode of the Obstructed River, the use of lung 7 is referred to as one of the 8 therapeutic methods. In this description of the application of the 8 confluent points of the extraordinary vessels to affect specific symptoms and areas of the body, lung 7 is indicated for disorders of the head region, rebellion, and blockage of phlegm and dry throat. Lung 7 is junction point or general junction point, exit point, opening point of Renmai, coupled point of Yin Chao Mai, heel vessel. This important point is similar in effect to spleen 21, as it is said to be a special junction point which affects all junction points. Lung 7 helps maintain rhythm, which is one role of the pull, and balance among all of the officials. Effective for problems of the mouth, throat, head, and nose. Considered for constipation or retention of toxins, both mentally and physically, often combined with Li4 and Li20 for this. Helps to enable the release of tears if suppressed by chronic grief and sadness. This point can be effective for heat and pain in the palm of the hand, tension in the chest disorders with heavy mucus or breathlessness.